So, we are here today because of one mom's tireless efforts to ensure that parents are able to act in the best interest of their children when they see a need for help. April Dugas's daughter Gabby developed a severe eating disorder and became suicidal after experiencing a severe trauma in high school. Now, Ms. Dugas was denied the right to consent for her daughter's mental health treatment, though it was clear that she could benefit from it because she was over the age of 14 and refused to provide consent. After her daughter's death, Ms. Dugas approached her local representatives, Pennsylvania State Representative Jason Ordite, to ask for a solution. It took 6 long years later, but we are really pleased that Act 65 of 2020 provides us with the opportunity to correct previous challenges. So a really quick timeline. As of September of 2020, Act 65 replaces Act 147. So if your institution requires a child over age 14 to consent before mental health treatment can begin and insists that the only way a child over 14 can be admitted otherwise is by a 302, now's a really good time to look at your policy. So here's the stats on how Act 65 of 2020 became law. It was submitted by a bipartisan committee. It passed through the House in June. It passed through the Senate in July. It was signed into law later on in July, and 60 days later became law. I only mention that because it's really important to know how long it took for this to happen. We hear people say all the time, oh, this law has been proposed and it's going to affect mental health consent here in Pennsylvania. And it's really important, again, to know how long this all took, um, and just focus on what the current law is. Now, if the law is updated, we will be certain to push out information to everyone across the state again. But this is the law that we have for the time being, so it's really important that we follow what we have. So the way these things are written, the words do not roll off the tongue, but we're going to go through the law so we're all on the same page. This is wording directly from Act 65 of 2020, Section 1, Line 7. It pulls no punches and makes it very clear. A parent or legal guardian of a minor less than 18 years of age may consent to voluntary inpatient mental health treatment known as the Mental Health Procedures Act. If inpatient mental health treatment is determined to be necessary by a physician, licensed clinical psychologist, or other mental health professional, or outpatient treatment on behalf of the minor, and the minor's consent shall not be necessary. So in English, what this says is a parent under the consult of a medical professional can determine that their child is in need of inpatient mental health treatment. For outpatient mental health treatment, obviously you don't need the consent of a doctor to go see a therapist because you haven't seen one yet. But this is pretty much the way things work anyway. You go to the hospital in pain and your doctor looks at you and says, yep, you need to be admitted. The same rule applies to a mental health admission. I can't just walk off the street and say, look, I'm not feeling really well, so I'm going to go up to a room, just tell me which one. Same thing for outpatient treatment. I'm going to present myself to my family doctor and say, hey, there's something going on and I want you to look at it. I don't need to talk to somebody before I talk to somebody to get treatment for outpatient treatment for, any kind of medical issue. So the same rule applies for outpatient mental health treatment. It's just normal, plain old treatment, really no difference. This is just reaffirming that yes, in fact, parents have the right to insist on mental health treatment for their children. A minor who is 14 years of age or older may consent on their own behalf to voluntary inpatient mental health treatment as provided by the Mental Health Procedures Act or outpatient mental health treatment and the minor's parent or legal guardian's consent shall not be necessary. Again, plain old English. Once a child turns 14, they have the right to seek and receive mental health treatment. And at the Parent Alliance, we fully support a person's right to access mental health treatment. We have no desire to restrict that ability in any way. Okay, so let's recap quickly. According to Act 65 of 2020, who can consent to mental health services for a child once they turn 14? Can children consent to their own mental health treatment once they turn 14? Yes, they can. Can parents consent to their child's mental health treatment as long as their child is under age 18? Yes, they can. Easy peasy. Act 65 of 2020 does not in any way reduce or limit a parent's rights to obtain necessary medical or mental health treatment for their child. All right, so this may seem a bit off topic, but this next section talks about the word abrogate. It's one of those legal words that you or I probably wouldn't use in daily conversation. So let's take a minute and go over it. It's a verb. I don't know why that matters, but they always play that out. It really means to repeal or do away with. And again, in a legal sense, a law, a right, or a formal agreement. So in a sentence, a school district may not abrogate the state mandate to begin educational transition planning at age 14. And some similar rules: overrule, do away with, rescind, revoke. So abrogate means that you can't override, overturn, overrule. So a minor or another parent or legal guardian may not abrogate consent provided by a parent or legal guardian on the minor's behalf to voluntary inpatient or outpatient mental health treatment under paragraph 1, nor may a parent or legal guardian abrogate consent given by the minor on the minor's own behalf. Okay, so this is really big. We are contacted by therapists all the time who ask if parents both have to agree to their child's getting therapy. And here you can see the answer is no. The wording specifically says another parent or legal guardian. So no, parents can't override one another, nor can they override a child. So basically, yes wins. If anyone consents to treatment, treatment happens. So we've addressed who can agree, but what if someone initially agrees and then changes their mind? A parent or legal guardian who provided consent to inpatient treatment may revoke that consent. Now, inpatient treatment will continue if the minor has provided consent. A minor who has provided consent may revoke that consent. Treatment will continue if a parent or legal guardian has provided consent. So you can change your mind. Always great to know. And if you change your mind and somebody else swoops in or has already in tandem provided consent, treatment can continue. So let's do a quick knowledge check of what we've already covered. So let's talk about Abby. Jennifer's the mom. She presents her daughter, 14-year-old Abby, for treatment of a previously diagnosed eating disorder. Abby has attended 6 weekly therapy sessions and appears to be making progress. This is the longest Abby has stayed with any therapist. At the end of her 7th session, Abby informs her therapist that she has the right to refuse and she's not coming anymore. The therapist feels Abby is exhibiting avoidance of the issue at hand and feels if they can continue to work together, a breakthrough will happen. Jennifer wants her daughter Abby to continue therapy. So now that Abby has refused therapy, do you think that therapy has to stop? Now, I'm not going to call anybody out to answer, but I'd like you to take a second and kind of come up with your own yes or no. So mom gave consent. So the answer is no. Therapy doesn't have to stop. Um, and Abby cannot overrule or abrogate her parents' consent and fire her therapist. Remember, our key words are one party cannot abrogate or override another's consent. So let's talk about 17-year-old Alyssa. 17-year-old Alyssa, with the help of her school guidance counselor, and shout out to her school guidance counselor, has sought outpatient therapy due to her feelings of anxiety. Her father's aggressive behaviors and verbal altercations with her mother make it impossible to even think when she is at home. After the first month of outpatient therapy, Dad finds out. He's furious and demands that Alyssa terminate her treatment. So again, take a minute and think, does Alyssa have to stop therapy? The answer is no. Alyssa doesn't have to stop treatment. Again, no one may override another's consent. So let's talk about how inpatient treatment is defined. All mental health treatment that requires full-time or part-time residence in a facility that provides mental health treatment. So people ask, does this only apply to hospitals? No, it applies to hospitals and residential treatment facilities that are providing mental health treatment. And I can give you guys a link where you can check with OMSAS on the RTFs, but if they are providing mental health treatment, Act 65 of 2020 applies. And again, I know we're going over this really fast. It's a lot to learn, which is why I mentioned we have a tip sheet available with kind of some down and dirty facts. We have a copy of the law available for you. We have a copy of this presentation, and you could sign up for our on-demand course. It takes about 15-20 minutes to complete, and then you'll know for sure what you know. Now, I do want to point out before we move forward that Act 65 of 2020 only grants a child the right to consent to mental health treatment, not medical treatment. Now, it's probably in a facility's best interest to get parents' signatures as well in case some unexpected medical treatment needs to be administered. Now, nothing prevents a facility from getting signatures and consent from both the parent and the child. And our forms are kind of set up that way anyway, right? When you check in, it's a signature of the patient or a signature of the representative. So it's not that you would even have to create a separate form. Okay, so let's take a minute and talk about our use of the word voluntary. So people often get confused because a child may not voluntarily be willing to go into treatment, either out or inpatient. Our use of the word voluntary, when we talk about that, it's not a 302 situation. So you often hear people call involuntary commitment a 302, which is in reference to Section 302, which is the section that applies to involuntary commitment. So a conversation may be something like, if you don't agree, you'll have to be 302'd. That's not the case. If the child doesn't want to be there, the parents can provide consent. Remember, only one person has to provide consent, parent A, parent B, or the child. So it's the legal guardians or the child. Any one of those, then yes wins. We also get the question if inpatient treatment will show up on state police records. So in our case, the voluntary admission, which isn't treatment being mandated by the court or a judge or probation officer or something like that, that kind of treatment will not show up on a state police screening. So you can see why a parent would really be concerned that when they hear, look, either your kid agrees to go in for admission or we have to 302 them. We know that a 302 will show up. And, parents, that doesn't go away even once a child turns 18. So parents don't want to saddle their children with that. Okay, so let's say a child is presented for inpatient treatment. Do they have an option to say, look, I really, honestly, and truly do not belong here, and I don't belong here? Absolutely. Upon admission to a facility, a representative from the agency will talk to the minor and explain the nature of the program. And they'll be given information verbally and a written copy that tells them that they do have the right to object. And if the minor wants to exercise this right at any point during their stay, the director of the facility will provide the minor a notice of request for modification or withdrawal from treatment. It's just a form. And the representative from the agency will then file that signed petition with the court. Now, once that happens, the court will promptly appoint an attorney for the minor, and a hearing will be scheduled to be held within 72 hours following the filing of the petition. And this just goes through the review of the judge, and they'll look at why the child is there. Is that an appropriate place to provide that treatment? They will make a decision, and then they could say, yes, the child must stay in treatment. And it kind of goes through it. They set a timeline. Once that timeline has been reached, if the child's treating doctor doesn't feel that the child is ready to be released, they go back to the judge, and the judge could say, no, you have to stay longer. And it just kind of goes through that circle until either the treating physician says, you don't need to be here anymore. Perhaps the child agrees, yeah, I'm going to stay. Or, the judge says, all right, they've been there long enough, they're going to go home. So I feel that it's really nice that if for some reason a child was in inpatient treatment for the wrong reasons, there is a legal recourse for them. So the question becomes, though, where is the child while all this is taking place? They're still in the treatment facility until a judge or mental health review officer determines if the mental health treatment is in the best interest of the minor or not. So they're not released. So again, just to kind of give you a super quick kind of overview, if a minor is ordered to undergo treatment, they will remain and receive inpatient treatment for up to 20 days. Now, a patient may be discharged when the attending physician determines that the minor no longer needs treatment, or at the end of 20 days, whichever comes first. Now, at the end of that 20 days, the treating doctor says, no, you really need some more time. They go back to the court reviews, the notes and the doctor's input, and they can decide to release the minor, or they could say, nope, you've got to stay for another 60 days. And this, again, just continues in a loop until they're ready for discharge. So let's talk about Jacob. He's in need of a residential treatment facility due to a sexually problematic behavior against his 10-year-old sister. Jacob doesn't want to go to a residential treatment program, and he's agreed to remain in outpatient therapy. But after speaking with Jacob's mother, or after speaking with Jacob's therapist, mom really agrees that a higher level of care is needed in order for him to make progress. So while searching for the proper RTF, mom is told over and over that because Jacob is 16 years old, he's going to have to agree voluntarily to go to an RTF. Is that true? Does mom have the right to sign for voluntary placement for Jacob? Mom does. Now, legally speaking, we can't force a facility to accept the child if they don't want to. And we totally understand why any facility would really want the child to agree to be there. It's much more healthy for their treatment. But sometimes kiddos don't understand. They don't know that they need treatment. And as parents, we have to make really tough decisions sometimes. So, you know, insisting that a child agree before they go is really challenging for many parents. And we really want to hold our RTFs feet to the fire and really make them accept those difficult cases. There's probably no place else where they can receive treatment. So falling back on, oh, they can't come unless they agree, that's not a legal thing. That's an internal decision. So again, mom has the right to sign for voluntary placement of Jacob, even though Jacob may not want to voluntarily be there. Now, of course, once he gets there, he has that right to request a hearing in front of a judge where the judge then, determines his need to be there. When there's a disagreement on only inpatient treatment, the child remains in treatment if they are already there, and the non-consenting parent has an obligation to request a hearing. This is in a case where we have parent A saying, yes, they need to be in treatment. Parent B says, no, I don't think that they do. The child stays in placement. And the parent who does not agree has the obligation to present at their local court where the child lives and files a petition, and then a judge decides. But that does not mean the child leaves treatment while this determination is made. So once one person says yes, treatment can begin. This caveat of being able to file a petition in the Court of Common Pleas in the county where the minor resides only applies to inpatient treatment. Okay, so let's talk about medical records. I think that sometimes when parents ask to see their child's medical records, they think it's going to tell them what's going on with the child, like what they said in treatment. And at the Parent Alliance, we can help parents understand that that's really not information that they're ever going to be able to see, because that's just not how therapy works. So if you have a family who has some concerns, by all means, feel free to connect them with us and we can work together. So a minor may consent to their medical record release and the information to release information to their current mental health treatment provider. A parent or legal guardian may consent to a minor's medical records and information be released to the minor's primary care provider if such release would not be detrimental to the minor. And then, of course, information is released from one professional to another. It's not like bringing home someone's homework where I'm going to collect their books and their notes and walk them to them. It goes directly from one professional to another. And the parent or legal guardian who is providing consent to the minor to receive mental health treatment shall have the right to information necessary for providing consent to their mental health treatment, including information like symptoms, conditions to be treated, medication, and other treatment provided, the risks and benefits, and the expected results. So I want to point out that Act 65 really is a solution for a problem, other than granting a child 14 and over the right to seek treatment. It really provides us with that guidance on the like in the situation where parents don't agree with their children, children don't want treatment, whatever, it really provides us a legal guidance on how to resolve an issue if there is one. If there's no problem, if a child is attending therapy every week and turns 14, nothing changes. Acts, nobody needs to bring up Act 65. It's just there, nothing changes. If a child is presented in distress with their parent or parents at the ER and isn't saying like, I don't want to be here, I don't want to be treated, there's no problem. So really quick, a quick summary. Act 65 of 2020 allows a minor age 14 and older the right to consent to mental health treatment. Parents, as always, have the right to consent to mental health treatment for their children until they turn 18. No parent may abrogate or override the consent of another. Non-consenting parents or legal guardians of a minor may object to inpatient treatment through the courts, and release of records and information can be requested by either the parent or legal guardian or by the minor, and basic information may be released to the parent or guardian.